Hi, I'm Joe Pfeiffer, President and CEO of HFMA. Welcome back to our web video series. This month, I'm talking about new research showing that so far, value-based payment is not having an impact on the total cost or quality of care, yet. Here's a snapshot. HFMA teamed up with the Commonwealth Fund, Levitt Partners, and McManus Consulting to analyze factors that may have influenced total cost of care in markets across the country over a 3-year period. We were very pleased to partner with these well-respected organizations on a study of this magnitude. Of course, it would have been great to be able to say, hey, we now have strong evidence that value-based payment is bending the cost curve. Keep up the good work. Unfortunately, we can't say that. But the researchers did come away from this study with several important insights and recommendations. In some ways, it comes down to this. The period we looked at, 2012 to 2014, was the early days of value-based payment. For most providers, value-based contracts had upside risk only. Physician compensation was mostly productivity-based. It's pretty clear that those aren't the right incentives to manage the total cost of care. Overall, financial incentives need to be a lot stronger before the impact of value-based payment can be proven. In terms of overall recommendations, the researchers had 3. First, keep moving toward models that increase financial incentives to manage the total cost of care. Second, speaking to the question of how consolidation affects prices, balance the benefits of competition and integration. A little competition can be a good thing, but, perhaps surprisingly, more is not necessarily better. And third, and this is not a surprise, support price and quality transparency. In the study, lower cost markets had organized mechanisms for doing that. The researchers also had specific recommendations geared toward various stakeholders. For that information, I encourage you to read the full report, which will be available in mid to late May. So that's a very quick summary. Next, I'd like to share my perspectives on the research findings and on the way forward. There's no doubt in my mind that all the factors the researchers identified come into play. But I suspect there's more to it. I believe that we, as an industry, haven't come to terms with the fundamental reality of the value era. We must change. Not just incremental change, not just shifting costs from one level of care to another or achieving cost savings that aren't passed through to care purchasers. I'm talking about real change, the kind that makes us uncomfortable. If we truly want to reduce the rate of cost growth to the rate of inflation, change is needed on 2 levels. The first level is contractual. Value-based contracts should be redesigned so that all parties have more skin in the game. Payment models that protect existing revenue streams, avoid downside risk, or don't effectively address chronic conditions won't get us where we need to go. The time for dipping our toes in the water is over if holding down healthcare inflation is truly important to us. The second level of change is more fundamental. We have to figure out how to operate at a margin in a value framework. You know the saying, no margin, no mission. Here's the part that's hardest to accept. Not everyone will come out whole. Consolidation must reduce waste and duplication, rationalize service delivery, and integrate cost-saving technologies into the mainstream. A lot of restructuring is going to be involved here. Healthcare organizations will emerge from this process looking very different than they do today. I don't want to minimize this. It's huge. But if we don't take this on, the value transformation will stall and maybe fizzle out. And if that happens, that uncertainty we hate will only multiply. The window of opportunity for developing solutions as an industry, rather than having them imposed on us, is closing. The time to take ownership of the value challenge is now. Thanks for watching. I'll see you next month.